Current government funding expires at midnight. So while congressional leaders keep working on a deal, in the next few hours, the House will try to pass a 48-hour continuing resolution to fund federal agencies at least through the weekend. The deal will include some coronavirus relief, but apparently it won't include the extension of paid and family leave for anyone who can't work because of COVID-19. And joining us to discuss this is Vicki Shabo, a senior fellow at New America and expert in paid leave. Vicki, thank you for joining us. Can you start off by telling us why you feel the exclusion of this paid leave in this package is so dire?
Yeah, thank you so much for having me, Renita and Scarlett. This is dire because on January 1st, as folks wake up to a new 2021, 87 million workers, including 60 million private sector workers and their employers, will lose the ability to have emergency paid sick leave and childcare leave during the rest of this pandemic. Congress initially passed legislation back in March, but those provisions expire on December 31st, leaving millions of workers vulnerable when they get sick, when they need to quarantine, when they need to get a COVID test, and for the 31 million parents potentially who may need paid leave that they can no longer take because their kids are in virtual school or no school or because they've lost their childcare due to COVID.
Vicki, it sounds like workers who are infected with the coronavirus will essentially be forced to choose between losing pay or going into work, potentially infecting others. Is this right?
Yeah, millions of people could face that choice. So once this federal paid sick leave for coronavirus purposes disappears, people are left really to a patchwork. If they live in a state or a city that has paid sick days guarantees, they may have some protections, but otherwise it's completely up to employers whether they offer paid sick time to their workers or not. Without it, workers are left in a situation where they may be forced to choose between being paid or even losing their jobs and doing the responsible thing and staying home when they are sick. This is an unconscionable choice that Congress is making not to extend this policy. It's not too late, they could change their minds. But right now, again, tens of millions of workers' ability to care for themselves and their communities and their loved ones hangs in the balance.
Now, while they do that, advocates like you are still pushing for the key inclusion of this in the policy for all the reasons you just mentioned. But what does the fight for that really look like? I mean, is there anything that can be done at this point, or is it simply too late?
Well, look, I mean, for weeks now, workers have been speaking out. Small businesses have been speaking out, asking for this. The deal is still being made as we talk, as far as I know. So it's not too late. Things always happen at the last minute in these deals. And this is a very small cost to extend these provisions. It's to 1,000th of the total cost of the bill that they're talking about. And at the same time, the other key thing about this policy is that it prevents 15,000 COVID cases per day nationwide. At a time when cases are rising, the death tolls are becoming just unthinkable, hospitalizations are rising. We should be doing every single thing we can to prevent the spread of this virus. And letting this program sunset is going in the entirely wrong direction. So it's not too late. Folks can call the Capitol switchboard at 202-224-3121 and ask their representatives and their senators to ensure that this is a part of the package.
Now, this points out a problem that existed before the pandemic, Vicki. Millions of Americans, they've lived with no paid sick benefits, paid sick leave benefits, rather. Now, do you think that COVID has brought this issue to light, and might it make a way for policymakers to make this a more permanent change?
I hope so. You're absolutely right. Lack of paid sick time has been a problem for more than 30 million workers nationwide. Lack of paid family leave to care for a loved one or a new child is a problem for more than 100 million workers. We are one of the only countries that deals with this on a state by state or an employer by employer basis. Millions of people have now been affected by the need to care for themselves or a loved one. And I really hope that as we turn the corner, as we head into 2021, policymakers take seriously the need for permanent solutions so that we are never in this situation again, whether we're talking about a pandemic that hits or a cancer diagnosis or a new child who needs to be with its parents in their first weeks and months of life. This is just a situation that is no longer acceptable to deal with in this sort of hodgepodge way that we have. We need national baseline solutions that recognize that everybody needs time to give or receive care at some point, and yet now too many people are left with nothing.
Vicki, in the very short time we have left, you were working on this just today. 48 hours until this is really going to be down to the wire. What are you doing in the last couple of days to make sure this happens?
I mean, I and colleagues at other organizations have been talking to lawmakers and their staff, have been trying to bring some of the business groups that tend not to be in support of these things to the table to say that they're at least neutral, to have workers and families contact members of Congress, tell their stories to the media so that it's not just a line item on a list of policy options that's abstract, but really we want lawmakers to know that this is a pro-worker, pro-business, pro-health, and pro-economy policy that is a small cost for an incredibly large reward, not just to the people who are directly affected, but to everyone around them who they can help stay healthy by staying home and by providing care, and for parents who need to care for their kids who have no place to go right now.
Okay. Vicki Shabo from New America, thank you so much for joining us.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.